Thank you, Lásán Corda. I welcome the opportunity to contribute to the debate this evening, and I'm also glad that the Minister has decided to accept the motion before the House and not move the government amendment, because I don't think there's anything in the motion that would threaten government policy anyway. Minister, mental health services have been the poor relation in our health services and have suffered from greater underinvestment than the rest of our services. The Mental Health Commission annual report for 2013 has highlighted what I believe is the biggest problems facing our mental health services. Of the 63 premises inspected for the report, only 44% had adequate staffing levels and 30% had adequate premises. And across the community mental health services, the situation in relation to staffing is just as bad and just as serious. The operation of the public service embargo is putting vulnerable people's lives at risk, and it is beyond time that the embargo was lifted in order to ensure that citizens can access the services that they need. When we look at the levels of suicide and self-harm in our society, we should see easily what needs to be done. We need to provide the staff to be able to provide the services. This motion calls for an adequate out-of-hours emergency services, and this cannot be achieved without putting the staffing levels in place. There are over 30,000 admissions to hospital each year due to self-harming. Providing staff in the community to support people at risk of harming will ease the burden on our hospitals and our acute hospitals and save money, which can be diverted into community services. I would like to take this opportunity to pay tribute to the work of spunout.ie and Jigsaw, who have been working with young people to help improve their mental health. And when we consider that we have the 4th worst mental health record for young people in Europe, it shows the importance and the value of the work that they do. I would also like to highlight an area that I'm familiar with, and that is the work of the community CAMS teams, and commend them for the work that they do in communities, assisting young people that are in need of help. But the CAMS teams are inundated with calls for help, and they need to be strengthened, and they need to be provided with the resources to help them to deal with all the demands on their time and for calls for their assistance. And Minister, in the HSE West area, there is one inpatient CAMS unit in Maryland Park Hospital in Galway, with 2 teams operating the unit. And we see that one of the psychologists in the team has been on sick leave since last September, and no cover has been provided for their work. And you have to wonder then about the government commitment to providing adequate mental health treatment for young people when the situation is allowed to continue. This situation highlights how the lack of staffing is impacting on treatment of our young people. And if we want to see a vision for change implemented, we have to invest in it.